Hey, I'm Carly. I'm going to be your nurse today. I'm going to go over some cranial nerves to make sure that your functions are normal and that your cranial nerves are intact, okay?
Okay.
All right, so we're going to start with cranial nerve 5. This is the trigeminal nerve. So I'm just going to ask you if when I touch your face, if you can feel it equally all over, okay?
Yep.
Okay, good. Okay, so since you can feel that equally, your cranial nerve is intact. The trigeminal nerve, its main function is sensory, so it's just sensation around the face, including the face, mouth, and cornea of the eye. If you had any pain with the sensation, it could be a symptom of trigeminal neuralgia, but since you don't, you're good. The next nerve is going to be cranial nerve 7. This is the facial nerve. This one controls muscles of facial expression. For this one, we're just going to see if you can puff your cheeks first and then smile. Okay, good. If you aren't able to do this, it might be a sign of Bell's palsy or a stroke, which you'd often see like facial drooping on one side of your face. Depending on like what area of the brain is affected from the stroke. You could also see this in Lyme's disease if the patient was unable to do this. The next one is going to be our eye movement nerves, which are going to be cranial nerve 3, 4, and 6. This is oculomotor. This one plays a role in pupillary constriction and eyelid muscles, as well as eye movement. Trochlear is eye movement in the inward direction. And then the last one is abducens, which is cranial nerve 6. And this is eye movement and the outward movement. So for this one, I'm just going to grab my pen light. And I'm going to start out by asking you to look at an object in the distance. Okay. And then I'm going to move my pen, look at an object in the distance. And then I'm just going to move my pen light in front of you. And when I do, you can focus on the pen light, but don't move your head. Okay. And now I'm going to assess the 6 points of cardinal vision. So just keep your head still and follow along with your eyes. All right, good. So all I'm looking for is when you go from a distant object to a close-up object, that your eyes are going to dilate at the distant object, and then when they focus in on a closer object, they're going to shrink, they're going to constrict. And then when I'm assessing your points of cardinal vision, I'm just making sure that, you know, your eyes can move in those directions and that your eyes are not shaky. If I noticed that your cranial nerve was not intact, then it could be an indication of unmanaged diabetes or hypertension, increased intracranial pressure, or an aneurysm that is putting pressure on that part of your brain. The next nerve that I'm going to assess is going to be the optic nerve. And to do this, we would just get you to look at the Snellen chart. This is the chart with, you know, all the letters on it, and they have different lines, and you try to read the lowest line. But because we don't have a Snellen chart, we know you have 20/20 vision. So we know that that nerve is intact. The optic nerve, its primary function is just vision. An abnormality that we may see is like astigmatism, farsightedness, nearsightedness, or if the cranial nerve is not intact, this could be due to head trauma or a tumor or even a brain aneurysm. The next nerve that we can assess is cranial nerve 8. This is vestibular cochlear nerve, and its function is hearing. So for this one, it's called the whisper test. I'm just going to whisper in each ear one at a time. And when I whisper something, you're just going to repeat what I said aloud. Okay?
Okay. Cat. Dog.
Okay, good. So I did say cat in the first ear and dog in the second ear. If your hearing was not intact, or if you're having abnormalities, it could be a sign of vertigo, which could make you dizzy. And then if your cranial nerve wasn't intact, it could be caused from trauma or congenital malformation, a tumor formation, or even infection. But yours is intact. The next nerve is cranial nerve 1. This is going to be the olfactory nerve. Its function is just smelling. So for this, I'm going to ask you to shut your eyes, and then I'm going to give you something for you to smell, and you're going to have to identify what that is, okay?
Okay.
So shut your eyes. Smell. Okay, what is that?
Pumpkin spice latte.
Okay, good. It is a pumpkin spice candle. If you weren't able to smell and cranial nerve 1 was not intact, this would play a role not only in smell but also in taste. You might not be able to taste things because those two senses go together. If it wasn't intact, it could be due to head trauma. You could just be born without the sense of smell, or it could be an infection, such as COVID. But hopefully after COVID, your smell returns.
Never had it.
Good. The next one is cranial nerve 10 and 9. We're going to assess those both at the same time. Cranial nerve 9 is glossopharyngeal. Its main function is going to be a sensation from the posterior tongue and the pharynx, as well as taste. And then cranial nerve 10 is the vagus nerve. The vagus nerve plays a role in the muscle of your vocal cords, so your ability to talk, and also your ability to swallow. So for these two nerves, I'm just going to ask you if you can say ah and then swallow.
Ah.
And swallow. Okay, good. We would see abnormalities if you did have a stroke. You might have dysphagia or aphasia, which is gonna inhibit your ability to swallow and speak. But your cranial nerve's intact, so we don't have to worry about that. The next nerve is cranial nerve 12. This is the hypoglossal nerve. This nerve plays a role in the movement of the tongue. So for this one, we're just going to ask you to stick out your tongue and then smile immediately after. Okay, good. I don't see any abnormalities in that. So the cranial nerve is intact. An abnormality could be tumors in the brain, strokes. You would just see maybe the patient, maybe you couldn't do it, or some drooping when it came to smiling. It could also be a result of a head injury. And then the last nerve we're going to assess is cranial nerve 11. This is the accessory nerve. Its main function is the movement of the shoulders and neck muscles. So I'm just going to ask you to shrug your shoulders at the same time. Okay, good. So cranial nerve 11 is intact. If it wasn't intact, then you might not be able to actually shrug your shoulders, or there could be weakness in one side. So that would be the same for a stroke patient, or if you have an injury to the trapezius or the sternocleidomastoid muscle in the neck, this would inhibit your ability to shrug. Do you have any questions about your cranial nerves?
Nope.
Okay, good.